You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. According to my first guest, he says no one should be wearing a loose-fitting denture. And today's topic, the new modern small diameter implants. With us we have Dr. David Yates. Dr. Yates, welcome to the program.
Well, thanks for having me, Randy.
Now, for people, and I've got lots of questions about these mini implants, but for people that don't know your practice, who's the typical patient and what are the different services you offer?
Randy, our patients vary from children up to seniors, people in their 90s, and we see everybody in between. We do general dentistry, crowns, bridges, whitening, deep cleanings, root canals. I know that's a bad word, but we do root canals, and so it's a pretty full service practice, but the exciting thing is the mini dental implants.
You like, we said at the top of the show, you said nobody should be wearing a loose-fitting denture.
Absolutely. There is no reason for somebody to be uncomfortable with a denture when there are so many new technologies out that we can get rid of them and give you a full set of teeth that don't come out.
Now you have this concept, I guess, in your area. It's called what? Gardens Dental Care.
Gardens Dental Care.
Okay, where you pretty much do everything right there.
Absolutely.
You don't send a lot of people out, I guess, to a specialist.
We do most everything in-house, which a lot of patients like because they like us and so they like to stay with us. We have a technology called CEREC, and what this is a CAD/CAM system where we're able to make a tooth in an hour. And so instead of a messy, goopy impression, and then we make a temporary for the tooth that we send out to a lab and they comes back 3 weeks later, we take an optical impression.
Like a wand goes in their mouth?
A camera goes in their mouth. We take a picture of the tooth. We design the crown on the computer. The patient's sitting there watching it the whole time. And then 10 minutes later, it starts milling in the milling machine. The patient gets up, goes, and actually sees the tooth being made in 10 minutes, and we take it out, put it in, and they're done.
Okay. And you do this also with, like, if somebody's just missing 2 or 3 teeth and you replace them with mini implants?
Absolutely.
You make the crowns right there?
Absolutely. Okay. We place the mini dental implants. That takes 20 minutes maybe. We take a picture of the implants, design it, mill it, and they walk out with their teeth. They had walked in with no teeth, they walk out with teeth.
Okay.
It's amazing.
Now we talked. It seems that there are 2 categories of people that benefit from the dental implants. The people headed to dentures and people that are already wearing dentures. Correct. Are there a lot of people with dentures where you are?
Oh my gosh.
You're in Palm Beach, right?
Palm Beach Gardens, Palm Beach County. I would venture to say there are literally tens of thousands of people with dentures or headed to dentures, meaning their teeth are going to be coming out within a year or 2. I would say there are probably enough people to fill Dolphin Stadium 2 or 3 times.
Oh, is that right?
Absolutely.
Well, if it's so good. Okay, so I guess they could, in one day, I don't want to get this, you could walk in with no teeth and walk out with an arch of teeth that's locked in. Is that right?
Absolutely.
Does that happen?
We do it all the time. Yeah. People come in, they hate their dentures, they can't smile, they can't eat. And dentures, I hate dentures.
Okay. But you told me in the green room you've made thousands of dentures for people.
I have made thousands of dentures, and it's an antiquated technology. George Washington, 200 years ago, what did he wear? He wore dentures, and he went to work on a horse.
Yeah,
Here it is. 200 years later, people are still wearing dentures. There's no need. They can have a fixed set of teeth locked in, and they can smile, they can eat whatever they want, and it's so much better than dentures.
How old can you be to do this?
I've never worked on anybody over 100, but I have colleagues who have worked on people over 100 years old wanting fixed teeth. I have worked on many people over 90, giving them fixed teeth.
So people that have they're wearing a denture, and you give them a full arch of teeth that don't come in and out.
Absolutely.
Even at 90, why would a 90-year-old want to do this?
Randy, do you like to eat?
Yeah, of course.
I mean, who doesn't like to eat? And even people in their 90s, they still want to socialize, they want to go out, they want to meet with friends, and the last thing they want to worry about is not being able to eat certain foods or having to get up from the table in a restaurant, go clean the denture out. Back to your original question on why these denture wearers aren't coming in. Well, most of the time they've had these dentures for so long, they haven't gone to the dentist in 10, 20 years because they don't have to, unless they get a sore spot or something like that. So they don't know their options. Nobody's telling them. They don't talk to people about it. So they have no idea that they could have a fixed set of teeth or stabilize their dentures. The next category is people who have dentures. They remember what they went through when they had teeth. Years and years of crowns and root canals and gum treatments and thousands of dollars and hundreds of hours in the dental chair, and they don't want to go back.
But isn't it true that if you've been wearing dentures, let's say 15 years, that you've lost bone and you can't do it, especially mini implants?
Randy, that is absolutely not true. People have that misconception that they don't have enough bone because they've been told that. But with the imaging capabilities that we have now and also the use of the mini dental implants, which are smaller diameter, we're able to place implants and give them a full set of teeth with bone that is perfectly good. How it's normally done, Randy, if somebody came in for an implant in another office, they would be referred out to the specialist and they would have a cone beam x-ray done. They would have the implant placed. They would wait a few months for the implant to integrate. Then they would come back to us and we would be able to place the
So
crown
two different
on.
dentists. They'd go to one specialist that does the surgery, and another dentist to put the tooth on top.
Correct.
You do both parts.
Whereas our office, we have the imaging right in the office. We take the cone beam x-ray right there. We can diagnose the case. We have them come
Now,
back.
what about these mini implants? Okay, there's traditional regular implants and then there's the mini implants.
Right.
Some people have told me, dentists have said, the mini implants aren't there yet. What's your response? I mean, they're not as good as the regular implants.
Absolutely not true. There's a study done by Dr. Todd Shack, one of the pioneers in mini dental implants, and he followed 6,000 mini dental implants over a 10-year period. So they're virtually identical to traditional implants in the success rate, plus they're half the cost, half the downtime, minimally invasive, and so much quicker and more comfortable for the patient to go through.
Okay, so you like mini implants. So nobody should be wearing a loose-fitting denture. Doesn't matter how old, things like that. What about osteoporosis? Can you have a little bit of osteoporosis and still qualify for this?
Absolutely. I like to say if somebody can walk into our office, they can have mini dental implants.
Let's talk a little bit about, because you say it's transforming, that you see transformations in your practice.
It does transform people's lives, Randy. The people come in, they can't eat, they don't like their smile, they've dealt with messy glue, denture adhesive for years and years. They can come into the office, walk out with a set of teeth that is locked in, totally different smile. They can eat anything they want, salads.
How soon can they eat after it's
They
done?
can eat immediately. I mean,
Really?
They are barely anesthetized. We don't have to numb up as much as with traditional implants. And they walk out totally a different person. Randy, I have this one patient who's probably 70 years old. He came in because he's had dentures for 20 years. His girlfriend sent him in because she couldn't stand him complaining anymore about
His denture.
his dentures. And he only wore these dentures 4 hours a day. So he came in wanting a cosmetic denture because he didn't know what his options were. He had no
Okay.
idea. He thought he needed a new set of dentures. He comes in and we told him about his options with mini dental implants. And I said, how would you like to have a set of teeth that do not come in and out, locked in, and you could eat anything you want and you could have the smile back that you used to have? And he's like, are you kidding me? I mean, seriously. And he is just loving it. So we had the teeth made. We had the surgical stents made. He came in, we placed the implants, put the teeth in, full set of teeth. That day he walked out with teeth that do not come in and out, with a smile he used to have, and he can eat anything he wants now. And his girlfriend is so happy. So he can eat anything he wants, meaning he can eat beef jerky, he can eat salads, he can eat corn on the cob, he can eat ribs.
Can he bite something with his front teeth?
Oh gosh, yes. They're locked in.
It's like even a carrot with the front teeth.
Absolutely. They're locked in. They're just like his. And this gentleman has not had teeth for 20 years. And so
what does he say to you when it's all done?
It's life-changing. He's like, why, Randy, why didn't I do this 20 years ago? Because he didn't know about it. When he came in to have the procedure done, he took a pill before he came in.
So this is oral sedation?
Oral sedation, okay. Relaxed him a little bit. No problem. But when he saw his teeth for the first time, when he held up the mirror, it was like, oh my gosh. I mean, it's like he had missed the last 20 years of his life. Now he has his whole life to look forward to. He can eat anything he wants, salads, ribs, corn on the cob, carrots.
So the roof of the mouth, by the way. So in a regular denture, the roof of the mouth is kind of covered. There's suction. So aren't the uppers fine?
With a denture, the plastic, the big piece of plastic covers your palate. That's where your taste buds are. So this gentleman, unless he didn't wear his teeth when he ate, hasn't tasted food for 20 years. Now he has no palate. It's a full set of teeth, just like normal teeth. The food tastes so much better, plus all the food that he can eat that he hasn't been able to eat for literally 20 years.
Do you hear eating stories?
All the time. All the time.
Are they ever scared to eat right away? Like, do they ever call and say, hey, are you sure am I ready to go?
Sometimes it takes them a little getting used to because they haven't been able to eat for so long. So once they try it out, they come back and they go, oh my gosh, it was so nice to be able to go to a restaurant and eat whatever I want, not have to worry about adhesive, food getting up under the denture, having to go to the bathroom and clean it out. It's truly life-changing for
Now, in dentistry, and we've had this discussion on the phone, that it's a lot of, I think I'm quoting patchwork. Like dentistry has been designed where fillings and fixing and broken, and with mini implants, you're saying it's like getting your teeth back.
It is like getting your teeth back. This is how people end up in dentures, patchwork dentistry over years and years and years, and they get to a point where the teeth are unsavable, either through decay or through gum disease. So the mini dental implants allow you to have a full set of teeth and not have to worry about the decay, and they're fixed. And
yeah, but what if you have bad gums? Like somebody has bleeding gums, bad breath, they have, I guess, gum disease. Not good candidates for this?
No, they are absolutely great candidates because the gum disease causes the bone to melt away, and that's why people lose their teeth. When you get rid of the teeth, you get rid of the gum disease. So they're able to
the gums get healthy.
The gums get healthy, and the implants are placed, and they just come in, get their teeth cleaned twice a year, just like normal.
So if somebody's watching this, right, and they're skeptical, they're worried about pain, they're worried about, they're too old or whatever. What's that consultation like? So they go in, how soon from the moment they walk in your office, can you tell them, we think, we can do this?
Randy, they can come in, I can sit them in the chair, we can take cone beam x-ray, we can immediately tell, and 99% of the time, they are candidates because we have the imaging capabilities to look at the bone.
You do it right there. Okay.
Right there, right then. And with the mini dental implants, it allows us to place implants where conventional implants can't be placed.
Now you're a dentist, so you probably think the smile is one of the most important things, right?
Doesn't everybody? I mean, seriously, you look at all the surveys done through the major magazines, you see those all the time, and the smile is always in the top 3.
Of what you find attractive about somebody else.
Of what you find attractive. The first thing you notice. When I look at you,
okay,
it's your smile. That's because it's a great smile.
Okay, well you're a dentist, so of course you notice those things right away.
I'm a dentist, but I think that's true with most people. When people are dating, when people are looking for a mate, that is one of the first things you look at, because when you have bad teeth, you don't smile, you cover up your mouth, you have truly low self-esteem, and so the smile is tremendously important. I'll tell you how important the smile is. People are truly discriminated against when they have bad teeth. If they're missing teeth, broken teeth, decayed teeth, they cover their mouths. You can have two sisters, same age, identical twins, in a job interview. Who do you think they're going to hire? One with bad teeth or the one that is smiling? They're going to hire the one that's smiling because it shows
So it's
self-esteem.
not like they're necessarily going to hire the prettier smile, but if one is smiling and one isn't, it makes sense to hire the one that looks healthy and enthusiastic.
Absolutely.
And that kind of a thing.
And
It's a good
so
point.
it's a shame that people go through their lives with this disability because it's easily fixed.
Now, in the movies, we were talking about when you want to make a guy look not so smart in a movie, you remove one of their front teeth, right?
One or more.
Okay. If you want to make them look poor, you give them bad teeth.
Crooked teeth, discolored teeth, missing teeth. And it's a stereotype, but it's true. And people are held back from dating,
You
from
see
getting good
changes in their
jobs.
personality? Like you give them a good smile, whether it's with mini implants or veneers or whatever. Because you
Oh
told
my
me this on the
gosh,
phone.
that's one of the best things about being a dentist, because we are able to change people's lives by creating beautiful smiles. We have a patient who had ground his teeth down over the years. They were small, black. He had a big mustache. It covered his smile so you wouldn't notice it. In life, if you don't like your smile or you don't like your denture and it causes you not to smile, you're definitely judged by other people because
They think you're like depressed or mad or angry or
absolutely
no
lowers your
personality.
self-esteem. If there's something you don't like about yourself, you're not at your 100%. So by giving people a smile and teeth that they're able to chew with and smile with, it changes their whole outlook on life.
Okay, so if people are watching this and they're headed to dentures, that means their teeth are loose, they're bleeding, you can extract those teeth. And then how soon could you put in the mini implants to get this started? If everything works out great.
If everything works out great, they can come in that day, we can get rid of the bad teeth, they can walk out with a fixed set of teeth that day.
Is this the future of dentistry, like no more traditional dentures, like in 50 years or something, or whenever?
In 50 years, I truly believe dentures will be a thing of the past. They should be a thing of the past now, because I truly believe they're antiquated when we have the technology to give people a fixed set of teeth like they used to have. The problem with dentures is that they're not attached to anything. They're pieces of plastic that float around your mouth, and when you chew, if you don't chew on both sides of your mouth, the denture rides up. That's why they always get sore spots. It's why they can't eat the foods that they want. So in the future, everything will be fixed.
Or attached to something.
Or attached to something to stabilize things and make it more like how God made us.
Okay, and when they come in, what are their fears? Like what are they most concerned about? Pain?
Oh, there's many things. Pain, cost, time. Those are the main things. And all of those can be addressed. Time, it's very time efficient. It's done in 2 visits. Cost. Randy, I'd like to talk about insurance. A lot of people have.
Yeah, but even if you have the best insurance, right, doesn't cover it. Medicaid does not cover these mini implants.
That's true. But we have financing that somebody can pay it off over 1 or 2 years, and it allows them to get the treatment that they need and want and pay it off comfortably.
Okay, good. So what are the options? Okay, so let's say somebody they can't save their teeth. They're headed to dentures, or the denture wear comes in. What are their options when it comes to these mini implants?
So we can use mini implants on the lower that the denture can snap in.
Okay.
And we can place a few implants on top for a denture that snaps in. And
So no more adhesive with that,
no
or a little
more-
bit of adhesive?
No more adhesive, and we're able to remove the palate on the denture.
Okay.
So they're able to taste their food. But it's still a denture that snaps in and out. If they want the next level up, we can place a few more implants, mini implants on the bottom, and then we can give them a fixed set of teeth that is permanently cemented on the bottom and the top, that is just like normal teeth. They don't come in and out. They're made of a very strong material called zirconia, and they look just like your teeth, Randy.
Is that right? And you can't tell the difference?
Cannot tell. They're beautiful. But my main message is, if you're embarrassed about your smile or you can't eat because of a denture, there are options, and just come in and see us. I have a patient who had been in our practice for several years, very well off, CEO of a major corporation, retired, lives on the ocean, but he didn't like his smile. His wife didn't like his smile. And he's been like this for years. And he said one day, getting his teeth cleaned, "Dr. Yates, what can I do to correct my smile?" We did a full set of veneers on him. He is a changed man.
Is that right?
A changed man. And he could have done this 20 years ago, but it was just something
So you
that,
talked as if almost, that people lost out on maybe some good years of their life because they hated their smile.
it's a shame.
Do you kind of feel that way?
Yeah, it's a shame. And so that's why I'm all in on it now, because they shouldn't waste any more time when they can have the life that they think they should have. If they
No, now, when it's all done, they smile more. Maybe they post photos on Facebook, selfies, smiling.
I think these people, after it's done, were probably not even on Facebook before. Now you're seeing selfies, you're seeing posts, you're seeing new boyfriends, girlfriends in their lives, eating at restaurants that they never thought they would have eaten at.
Now, I know a couple of denture wearers. They never complain. Are you saying there's no such thing as a happy denture wearer?
Randy, because you're not a dentist. They're probably friends of yours. They're not going
Okay.
to tell you,
Okay.
but they're going to tell me. And so, oh my gosh, I don't know of too many happy denture wearers. And they don't complain because they don't know their options. Randy, for most denture wearers, if they do go out to eat, they have to look at the menu. What can I order that my denture won't fall out? Or if they do eat, no matter what they eat, they usually have to get up and go to the restroom, excuse themselves, remove the food that's caught in their denture. I know of many, many wives over the years who had been married years and years, and their husbands didn't even know they had dentures.
Really?
Because they were so embarrassed. So they had to alter their schedule. So the husband was out of the house, or it was late at night when they would take their teeth out and clean their dentures. And it's truly affects your life negatively.
So no more dentures. You're going to wipe it out in Palm Beach? Is that your goal? What are your goals?
If I could wipe out dentures in Palm Beach, I would be a happy, happy dentist. That is for sure.
What about pain? I mean, it does seem like it would be painful.
People think there is pain, and with traditional implants, there can be, because you're making a big hole in the bone. But with mini dental implants, we make a tiny little pilot hole, we thread the implant in, and it's just local anesthetic. There's very little discomfort. Actually, people are very surprised when replacing the implants and afterwards, because I don't even give them pain medicine after.
When they go home?
When they go home.
You
I
could,
tell-
though. Some people do.
Oh, I could. Advil is all you need, and it's virtually painless.
Now, because we're a news program, that when I hear people say painless or things like that on the show, I mean, some people do have a little bit of pain, obviously. But for the most part, you're saying they don't really complain about it.
For the most part, very, very little discomfort. One of my dental assistants was missing posterior teeth, back teeth on the bottom, had been for years. We placed many dental implants, minimal anesthesia, made the crowns that day. She came back to work the very next day. She said, Dr. Yates, I don't even feel these. So most of the time, there is very little discomfort. And thank goodness she replaced those teeth, because when you don't replace teeth
In the back?
your bite collapses. So where you could place teeth down the road, you might not be able to even have implants in those areas.
Okay, so mini implants, they're they're proven now, you say.
Proven over and over and over. Proven over and over to last. And actually they are FDA approved for replacing missing teeth.
Okay, good. Now, we are completely out of time. Final message. Somebody's watching this, and for whatever reason, maybe they have a denture, but they're still afraid. Maybe they're skeptical. They think they're too old. Or somebody with really bad gums, and they're headed to dentures. Or they've been told somewhere else they don't have enough bone, as you mentioned earlier. What do you say to those people?
I say call our office. Call us, come in for the free consult, and let us take a look, and we'll be able to tell you immediately whether you're a candidate, and you probably are.
And you do imaging there, right
do
there.
the
Do you
imaging,
charge them for
right?
the imaging on the free consult?
I will not charge them. If they tell us that they came from the Wellness Hour.
From this show?
From this show, I will not charge them for the imaging, which is a $350 value.
Okay, good. So, well, I want to thank you for coming on the show. And they get to meet with you. You meet everybody
Absolutely.
on that consult?
Yes, me and my great team.
And within about 20 minutes, we should mention, by the way, because I hear dentists on the phone or whatever, but you said, look, can I fit in that we just have the best team? Everybody says that, though.
I would love to give a little shout out to my team, because they are super good. And when somebody calls the office, they will see how nice we are. And when they come in, they'll just love our team.
Now, we haven't talked about your training. I mean, you told me 24 years in school. I don't even know how that's possible.
Yeah, it's possible. Yeah, a long time, a lot of continuing ed. So you could say I'm a continuing ed junkie.
Is that right?
Yeah.
Okay, good.
So.
And the fact that you do both parts, you do the surgery and then you put the teeth on top right there, is it less expensive, you think, than going to a couple of guys, like one specialist and another person? What are your thoughts on that?
It's actually about half the price of conventional implants.
Is that right?
Which really opens the door to a lot more people being able to accept this treatment, because cost can be a factor when you're dealing with traditional implants.
Okay, good. All right, I want to thank you for coming on the show. Good stuff.
Well, thanks. Thanks for having me.
You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.